So I've just been told we don't have a session host for today. No. No. Those of you who know him, no. This session is about UCLA, so I'm not going to do the session hosting bit. We'll just get straight into it, if that's all right with everybody. So for those of you who don't know me, my name is Vix, and I look after healthcare for Jamf. We are here today to learn how UCLA went from inception to conception, the other way around, with Apple TV. Gents?
This is us.
Introductions, my turn.
Yeah.
Right, you said you were going to say a fact about yourself.
Yeah, my fun fact.
Yeah.
So I hold enablement sessions for the Jamf teams internally, and when I meet them all, I always ask them for a fun fact, mainly because there's so many of us, I use it to try and remember everybody. My fun fact is always the same one, which I've realized is not actually that fun. I have broken my toes multiple times, over and over. My husband said it's weird, from falling upstairs. Never down, just up. I don't know why. I don't have particularly big feet. They're quite small, like a US 8. And yeah, that is my fun fact.
I don't know how I'm going to follow that. I'm Tim Knox. I am the senior consulting engineer at Jamf that's focused on all of our industry solutions, healthcare being one of those solutions. I've been at Jamf for 9 years, and I think I've done my math right that this is my 12th JNUC and the 9th one that I've presented at. So it's been super fun to see this grow as big as it has over the years. And my fun fact is that at a very, very brief time in my life, I did stand-up, and so nothing can hurt me when I'm on the stage because I have been hurt. And
does that mean not?
You all do not scare me, is what I'm saying.
It's pretty good. Hi, everybody. I'm Keith Cox from UCLA Health. This is my third JNUC, second time presenting. My fun fact, this was really hard to find and very embarrassing, so I don't know how excited I am to share this on video, but in college, I thought that I had a future in the entertainment business, and I flew to San Francisco to audition for a show called The Apprentice. And thankfully, I did not make it. And my dreams of working in healthcare IT have come true.
Watch the box.
Oh, I'm still in.
All right.
Should we get started?
Let's do it.
You don't need me to run through the session agenda. You're all very capable of reading and doing technical stuff, far greater than I am. So we are going to start off with how, why, and go through the entire journey with Keith today. This is an exciting thing for me, mainly because I met Keith last year for the first time in human flesh when they allowed me to come over to JNUC last year. And we were all sat around having a lovely healthcare discussion, and I was like, so which one of you guys are going to help us present next year? Keith didn't offer, obviously,
True.
So therefore was voted in by me. So we decided that we would talk about how, why, what happens at UCLA, because for me it was really exciting and interesting to learn the pitfalls and what we're going to go through today. So with that, I believe it was JNUC 2022.
That's where the idea came from.
Where it all started. So this just emphasizes for me how much our healthcare community means. So in 2022, you were at JNUC, you learned about Apple TVs.
We had a panel, so we had Cincinnati Children's, UC San Diego, and Colorado Children's, and we each talked about our different Apple deployments. So we have bedside iPads for our main patient engagement, patient experience application, and was curious about Apple TV, and learned about it from the other panelists, and have texted Walter many a time to get information about how they manage this at Cincinnati. So we started the discovery process at UCLA of what would go into doing that, because we had heard a number of complaints about the TV solution. The TV, it's just traditional cable. There's no flexibility to add stuff. Nursing units always asked if we had custom content, could we put this on the TV, or create a channel for ourselves, which in theory you could with some very old technology that's managed by the kind of campus cable provider.
So you learned all about it at JNUC 2022.
Yes.
In 2023, we all got together, and obviously I convinced him it was a great idea to be here today. And we, in that interim, set up a little community for anybody who touches healthcare. And for me, it was always about building that healthcare community out so that we can share and we can learn. So Keith's story for me is really important because it absolutely is the epitome of why we all come to JNUC. That is what we're all here for. So we had a panel discussion there with Walter and Kevin. And we discussed about learning from each other there. So the theme keeps going. So next year, I want to keep that going for all of us. So with that in mind, when we started discussing about UCLA and the Apple TV proof of concept and what that looked like, do you want to talk us through it?
Sure. So we did a lot of discovery, and I think the big emphasis was on the perception that there would be a lot of infrastructure required. And we met with all kinds of people from the infrastructure side, campus facilities, IT facilities, to realize we have power, we have data behind each TV, and a TV in the room, which with the Apple TV, managing it in Jamf and the MDM, you can basically put them in. That was kind of what we concluded. So went through all these groups, got all the different stakeholder buy-in from nursing, and eventually got the approval to move it forward.
Because it's kind of amazing how many people you have to talk to in the healthcare industry. I don't know if it's the same. I don't think it's the same in like a retail location when you try to make big changes like this. Maybe if you're talking about like the point of sale systems. But when you're talking about a device that's going to be sitting in a patient room, like you're talking literally to the networking team, to the nursing team, to anybody who's going to touch that patient or touch that room, which could include people who are turning the room, cleaning the room. Everybody needs to be involved in having that conversation. There's a massive lift.
Don't forget the governance people. They
and
always
governance
like to
people.
have their little say too, yeah?
Yeah, absolutely. I've worked with a healthcare organization that they wanted to make sure we had the right color cases on the iPads that were in the patient room because it had to match the color scheme of the entire hospital because of everything had to be the same. It was it's
I feel
remarkable.
that's like my handbags and shoes, but we'll move on from now.
Yep. All right, so you were skeptical that you were going to get approval. You got the approval, and talk about how the Apple TVs and the iPads were going to like play together.
Yeah, exactly. So thankfully, we have all the governance set up for the iPad. So all of our apps are reviewed by nursing committees who approve them. We have an extensive testing process. The iPads are obviously on the Wi-Fi. So we went through all of those governance groups to approve what apps would be available on the TVs. We have all the test units set up. We have our amazing Jamf admin, Jesse Nahara, who's not here, who built out the console for Apple TV. We talked to Cincinnati Children's, who gave us the advice to wire them so that they could have essentially return to service without return to service.
Right, before that existed.
Yeah, so we could wipe the device and it would set itself back up. We're also always looking for ways to further engage people with the iPad. So the iPad being the TV remote was part of the vision. So the TV remote app is what we use, and thought that this would also help keep the iPads in the room because we learned the more critical the use case, the more people figure out exactly what they need to do. So,
so the wires of the Apple TV, just to get into the little technical part of it, we're going to talk about the healthcare listener in a little bit, but when the patient gets discharged, we do want to make sure we clear all the patient data off those devices. And so the Apple TV being plugged into Ethernet meant that at the time, and still means that it could wipe the device completely. And because it's connected to internet already, which is the main limiter for being able to get devices back online after a wipe, it's already online. So you could skip through all of the language in the region and the Wi-Fi because it was hardwired and get fully set up again for the patient room without needing to have any human interaction, unlike iOS devices and iPadOS devices at the time, which has been remedied, I would say, 80% now with return to service, and we can talk more about that in a bit. So is that about right?
Yeah, the only other thing I would add is just our biggest complaint from nursing is they don't want to have to do anything, as I'm sure, with the devices. So
Right, with the devices.
adding to
they do want to do
they
things.
do want to do a lot of
Is that because
things.
they want to do nursing?
Yeah.
Yeah,
Yeah.
they don't want to be IT
just
people,
checking.
which is kind of crazy, but I guess.
Yeah. So with the Apple TV being the remote, we need to make sure that we pair those things together.
Yep, so which somebody has to do.
Yeah, and Jamf did. So we would pair these devices together. I think I'm going to make this bigger. Yeah. So with AirPlay restrictions, which is currently in the Jamf console, has been for a long time, you can match inventory fields from devices and make sure that those two devices can AirPlay to each other, but not to anyone else. Like in my apartment, I live in a dense area. I have been interrupted on my television by somebody trying to AirPlay. I've fixed that by enrolling my device and taking care of it. But if you wanted to be able to make sure that Room 101 can only AirPlay with Room 101 and not interrupt somebody watching a movie on their patient across the way, or accidentally sharing something that might be personal information from their iPad, maybe from their chart or whatever, up to their television. Marrying those two devices together by having that inventory field match is the best way we found to make that work. Works great. And it is I would say, fairly seamless, assuming everything's on the same network and you don't have any of those sort of networking problems, which you didn't have any of those problems.
Oh, no. We just plugged it in, it worked.
Great. We can skip to the end then.
That's not exactly how the story goes, guys. So when Keith and I were talking about this, we were like, you know, in IT, we all know that the testing piece is the most important. It has to be. When I worked in IT, we used to test till the nth degree to make sure that we weren't going to upset people doing those clinical works that they needed to do. And then when Keith and I were talking about it, he was like, we've got to put something in about test. Testing is the most important. I was like, but we know this. We work in tech. We know.
No, people put...
But no, you're right, Tim. So, hence, there is a lot of tests on the screen. Do you want to talk about that?
Let's do it.
Okay.
So we did a lot of testing at home, which if you've used these devices at home, they work seamlessly on your flat home network. It's almost as if they were designed for that.
No way.
And in our multi-layered, complicated network in the hospital, I learned all about multicast, and most enterprises, from what I understand, have multicast traffic turned off for security reasons. You have to turn it on to be able to have the Apple TV and the iPad communicate. So over Bluetooth, the iPad and the Apple TV communicate seamlessly, which we'll get more into that. But so all that to say, we learned we have to test in the actual environment. How do we do that? This is the break room in our pediatrics unit. We put the Magic Fireplace app on the Apple TV. And I came in one time and took this video because the nurses had a fire going. They had the heat cranked and the lights down, which was, I think, the best advertising for this new solution that was coming.
And you're in UCLA, though. I mean, so it's pretty
warm
most of the time.
You would think.
Okay.
I mean, they had it like 80 degrees. It was probably 70 degrees outside, but.
All right.
I think it's
Nice and
that
cozy.
whole user adoption piece as well, isn't it? Is that if you can get the clinical staff to buy in, you can get them to understand what we're trying to achieve.
Absolutely.
Let them experience it for themselves. It's kind of half the battle is then won. I think from my personal experience rolling out iOS devices, for us, it was most important to get that clinical buy-in. You go through that stakeholder process that we talked about before, but actually to get them to have hands-on makes the massive difference. So for you guys, this was like an aha moment then, wasn't
Big time,
it?
for sure. And we have this set up too, so we do all our iPad and Apple TV testing in this nursing unit. We learned we need one at each hospital because we assumed that the network configurations were the same at each. We heard from our folks that work on this stuff that they are the same, yet we experience sometimes things break at one location and not another. So testing on-site at all of the locations we recommend doing that.
So testing is the key message if
Big time.
nobody got it.
Big time.
Okay. So we've also discussed that whole infrastructure piece time and time again. I think I drew it out on a whiteboard so I could understand it. Yes, I am that old that I have to do those things. And we talked about the networking, the infrastructure that's behind it. Like you mentioned then, for us it was, well, it should work because it's the same. Everybody's telling us it's the same. But we all know that that's not always the case, is it? We go through highs and lows through any projects. We know that. We expect that, and hopefully we learn from them. So can you share a little bit more about what we discussed in that conversation?
Sure. So with the specific problem, so having the wired Apple TV communicate with the wireless iPad and broadcasting the multicast traffic to be able to speak to each other was a big lift and a pretty complicated architecture, from what I understand. So we probably spent 100 hours troubleshooting, and we have an Aruba infrastructure, so we had Aruba engineers, Apple engineers, Jamf people on the calls, and so we learned many things. But one, if I had to redo the pilot, I would do it in like 4 rooms and not 40, and in 1 geographic location, because once we got it right, then we could expand. But once we had gone live, we started getting tickets for like 30 Apple TVs down, or like 2 whole nursing units, one of which being peds, not having television, which is a problem.
Yeah,
So.
we've got to watch Bluey, super important. So part of this, and I don't know if we'll talk about this later, if not, we'll just skip it. We'll talk about it now because I think it's interesting, and I have a mic, so I can do that. The Apple TV remote app, which uses Wi-Fi, but the Apple TV remote is Bluetooth, right?
So AirPlay is over Bluetooth, and TV remote app is through Wi-Fi.
Okay. So that's why there's problems because it all has to go over the network, right? So with like the remote itself, like the physical remote that you have in your hand, that's a much more reliable kind of communication.
So we're talking about connectivity issues here?
Yeah.
Okay.
Yeah.
Yep. And then the remote app, which, has anybody used the remote app? Like, when you're on your Apple TV, does anybody like open your phone and use that app? Is that common? Some? Okay.
I see hands.
I was expecting it to be fewer. I almost never use it because I have a remote, which I can just grab from the side of my couch, but a lot of you don't, because you're using these devices, which we want to encourage the use of with the patients because they already have them sitting right there. So like, let's try to increase adoption of these devices by making them important, like turning your television on. So. And
not leave the nurses with the tiny little remote that will likely disappear and people have to track down. Yeah, and repairing issues and all that. Tons and tons of stuff going on there. Yep, and I see in the notes that you had ACL disallowed all traffic? Yes, so we had some firewall issues that took some months to discover, where one small setting to not allow certain traffic. So with the multicast traffic, our security team wanted to make sure we limited it to only the TV remote app being able to communicate, which there were some lessons learned for the Apple engineers too. They didn't have the most up-to-date information on what the specific information was for that traffic. So all of us learned something. Great.
Nice. We like to learn.
So we bang our shins so you don't have to.
Exactly.
So let's talk a little bit about the healthcare listeners, because that's sort of the part of the core of why these devices are sitting in the room. For the folks who haven't seen it yet, it's been around for a long time, but essentially what the healthcare listener does is it is a little tool that sits on behind your firewall in your hospital system, ideally. For me, when my testing, it's just sitting in a M2 somewhere up in AWS, and it works fine. It is listening for admit, discharge, and transfer, ADT commands, so that when a nurse discharges a patient from a room, the healthcare listener hears and understands that discharge command and will then issue an MDM action based on that command. So if you want to wipe the devices based on a discharge, it can do that. It will hear the discharge and it will send in erase all content and settings. The new thing that we're working on a little bit is a couple of folks have been using the return to service app to fire off in single app mode, which will then return to service a device instead of going through a device wipe and waiting for the nurse to reconnect the device to network. It fires off the return to service app, which then does return to service.
Which we love, by the way.
I love it too.
It's been a game changer.
I would love to see it actually being fired off through an actual API command rather than through an app. Hopefully we can get that solved sooner rather than later.
Are you working on that, Tim?
I'm not working on it. I am helping people work on it.
Yes.
And because I am a pedant, I need to make sure that I explain all of the terms that I've said. Return to service is the ability to send an erase all content and settings command to a device, iPad or iOS device, but it retains language, region, and Wi-Fi. So when you do the destroying of all the data, it will then rejoin the network, it will re-choose the language that you had selected, and it will rejoin the region you had selected, which used to be unskippable steps in the setup assistant. And what that means is you could push a big red button, and it will wipe the device and get it fully back set up again into the home screen without having any human interaction at all. And if you want to see that in action, following this session, I have a lab downstairs that does include a return to service action. It's mobility and security session. And in that session, we do have you go through a full device wipe using return to service, and you can watch it nuke itself and set itself back up.
It feels like you planned that, Tim.
I did not. I just start talking, and I don't really know where it's going to end, and it happened to end nicely. So
That's good.
that's great. So we can talk more about the healthcare listener in the question and answer section, but what it does is grants the ability to destroy the patient data on discharge or transfer or admit if you really wanted to. And that's the healthcare listener.
Thanks, Tim.
Cool.
Much appreciated. So part of my role within Jamf is to understand the use cases, to make sure that actually we are putting the patient first, to make sure that we are putting our clinical staff first, just to reduce impact, make life a bit easier for all of us. For me, I was talking to Keith, and it is my favourite part. I get to see all of the cool stuff that Jamf gets to do globally. So for me, it's always about how have we helped, what does it look like, who's managed to achieve what. So I asked Keith and said to him, tell me some fun stuff. This is the stuff that I need, because then it helps me go back to our business and go, oh my goodness, we did this, look at us. And that makes me really happy. So we talked about it quite a lot, and we've got other cases that we're going to talk about, but I asked you about this lady. Don't tell anybody, it reminded me of my mum, who is not tech savvy in the slightest.
They can hear you.
And it reminded me, and I was like, can we talk a little about what this picture actually means, what that means for you as a business?
Sure, yeah. So one of the things that we're testing with our POC is the TV remote app. Like, will people be able to use it? Will they be able to swipe down and use Control Center, navigate with their finger? And we'll get more into that. We found with our rounding that about 75% of people had no problem. And so our age ranges also went from, this lady's 101 and gave us permission to take this photo. We put it in an article that we published about telemedicine. But so she was an iPad user, Jamf Video Visits user, Apple TV remote app user. You can see the nurse obviously is required to be a part of the conversation, orienting her to the device. But so we got a lot of this great user feedback. And these are the populations that we have pediatrics and we have geriatrics all in one building. So how do we have an accessible solution for everybody? And if it's not, what does it look like? Which we got that information.
Do you find that it then impacts the IT staff or the clinical staff more?
The clinical staff. 100%.
And how do they feel about that? Because I know how I would have.
They are not fans of adding things to their workload. Our goal in all the stuff that we do with patient engagement in the room with bedside iPads and Apple TVs is how do we take stuff off their plate? So how do we automate workflows? How do we put stuff in the room that will remove things from their workflow? So this obviously at times adds to their workflow. So we're working on how do we remove that?
Love that. Love it. So we talked about the rollout. We've talked about the remote. We've talked about the firewalls and everything else that's happened over the last year or so. Is there anything else? And I think we can probably move on to the next slide for the
I can do that.
the more cool stories, the bit that I love the most. So we've obviously shared quite a lot of stories over the last year about how this is impacting. Mm-hmm. So I think, yeah, I'm going to shut up. Go.
Yeah, I mean, so the purpose behind why we did this was giving people an opportunity to further engage in their care and their experience in the room. And entertainment is a big part of it. It's a documented therapeutic technique in our psych area. It's a de-escalation technique. go to any children's hospital, our children's hospital. It's crucially important to have people be distracted and relaxed. And we see this on rounds when we talk to people. So we've heard everything from kids who are able to have their same, a 6-year-old who's getting chemo for 2 weeks the mom's able to sign in and be at the same spot in their TV show on Netflix and have that same distraction experience that they have at home in the hospital. And all the way up to, I heard a nurse actually from this unit told the story that an older gentleman was on end-of-life care and the family really wanted to find this specific genre of music, and Pluto TV, which was our main TV provider app, had a whole streaming channel of music on that amongst the hundreds of channels, and found a lot of comfort from that. So that's the kind of stuff that we want to be doing, and letting the nursing units tell us, hey, we have a large Spanish-speaking population on this unit. Can you put Telemundo and these other channels, make those available, stuff like that. So, and then one other plug that we love, we use Swank on our iPads, and they've been a great partner. They created an Apple TV app that we're piloting, and it's been great because it has very clear content, and the feedback I got from patients was they don't want to be going through. We thought Pluto would be amazing because it has hundreds and hundreds of channels. Turns out when you're waiting for or recovering from surgery, you just want to push a button and pick the TV show or the movie, or if the patient just wants something on in the background, the nurse just wants to pick one thing and not have to decide, which genre of TV this person may like. So Swank made an app. We're doing their beta testing pilot of it, and it's been great.
Cool.
So I think my takeaway from that is, let's see how people want to use these devices, take that feedback, and then perhaps alter the scope of what we're doing to make sure that we encompass those things moving forward, if viable, just to make sure we're not going to say yes to everything. And then it helps you then move forward with your projects on what to focus on next. It's a learning experience, isn't it?
For sure. And that's what we do with the iPads. They're customized by unit, by population, and we want them to be helpful. So that's been the best way to engage the nursing staff. And one thing I didn't mention, this particular unit does a lot of patient education. One particular initiative, reducing falls in the hospital. The thing that they correlated with reducing falls the most is early education of the patient and the whole group. So they airplay their education video on admission for all patients so that everyone in the room is educated on, I know your mom wants to go to the bathroom and you can normally help her, but you have to call us to take her, because that, over time, we've seen reduces falls.
So these are videos that the clinician has on their iPad and they're airplaying it up to the televisions, or is it in the patient?
It's in MyChart Bedside for the patients. They're assigned automatically based on condition.
Oh, that makes sense.
So everyone in the hospital gets a falls video, gets a hygiene video, gets a wellness video.
Gotcha.
And then we track the falls video compliance to correlate it with actual falls.
Neat.
I'd like to shout out Vera, the lady in the picture, just in case.
Me too. She's wonderful.
She is fabulous. Probably somebody I would aspire to be. It makes her happy, but not only that, it impacts the hospital, because we've seen a reduction in people falling due to the education piece that we are able to provide by Vera's program.
Yep, and so this is our most engaged MyChart Bedside unit, which is the 2 units we picked for the Apple TV pilot, we picked based on their iPad engagement. So one was pediatrics, and then Vera's unit is intermediate care, which may not be where you would think to start. The patients are pretty sick. They usually just came from the ICU or are going there, but because the staff are so engaged, that's why we started there, and it's been great. So,
and being able to get, and we have not talked about me talking about this before, but we've got like 15 minutes, and I guess we'll just talk about more of this. One of the things that is also important, I think this also goes for people not in the healthcare space, people might be in the airline industry or whatever, understanding how the devices are being utilized is super important, and something that Jamf does not have a lot of visibility into. Seeing apps that are launched, understanding what these devices are actually being used for, like in a console situation, is really hard to get. I know you built something, I'm going to just plug Security Cloud real fast.
Sure.
Most customers have access to the ability to grab Secure Cloud, our Security Cloud tool, which can see app usage based on network traffic, essentially. So you can see that this device or this collection of devices has access to these apps or not these apps, which can help clarify which apps are actually being used when people are requesting these apps and which ones aren't, or maybe being able to help remediate some of that. So if you're not using Secure Cloud and you want to try that out, I know there's ways that we can, I'm sure your sales teams will be happy to help you out with that. But you also built something that worked and maybe isn't going to work anymore, but
It's not going to work anymore.
Yeah.
Jesse and Alex on our team that do the Jamf administration showed me that I created a dashboard that showed devices that were set up and had all the apps downloaded, because you'd have to take an action to do that. We don't see nurses setting up iPads just for the fun of it.
Right.
So then we could assume if it's set up, it's being used, which was helpful because it pointed us to peds and to some ICUs that we didn't know used the iPads, and we learned almost 100% of our pediatric patients in psych and in medical use the iPads, but mostly for entertainment. And then in the ICUs, it's video visits, and then everywhere else, it's MyChart Bedside. But if anybody does know of a way to track app usage, we're trying to figure out, like, if a nursing unit gives us 10 apps that they want, how do we find some way to know who is using them?
Right. Or if they're being used at all, because if only 8 of those are being used, then let's yank the other 2.
Or we pay for apps,
Right.
and it's on the app developer to give us the data. The datas aren't always great.
And if that is of interest of wanting to know how to do that sort of stuff, let's talk afterwards, because maybe we can get creative, or maybe we can help create a case for building something like that, because I think a lot of people would like to have something like that.
For sure.
Cool.
It
Little
is a
tangent,
topic.
sorry.
Yeah, no, it's good because this is what the community is about here. It's something that we were discussing yesterday, that actually this is something that people do need, and trying to find a way around it to make sure that there is a cost, obviously, associated with those apps that we're purchasing, but also usage to prove why we need more, why we not.
Or to
we
see
need
what's
the data.
important.
Yeah, exactly. Absolutely. So I think that's it. Is there anything else we've missed? Have we covered everything else?
I am certain there will be questions from folks who are trying to deploy Apple TVs out there, so maybe.
Perfect. Well, with that then, Keith, thank you. I promise I won't rope you into any more. Not now anyway, maybe next year. Tim, as always, thank you. Please do hit up Tim Knox for any technical questions. He's going to adore the fact that I've said that. From an industry workflow, Tim is the man. He is the gentleman that I get to take around the world with me to make sure that we're doing the good stuff. So as we don't have a session host, I'm going to jump off the stage and ask, are there any questions? And thank you ever so much for joining.
Thank you. Questions? Got one. Cool. Run. You said you were a good runner.
Yeah, no, I can't run, and there's steps. There's toes in the facts. No, thank you. See.
All right. Okay, so two-part, I guess, separate things. Can't you get the app information on the back end into Jamf, the app usage, and then create a report?
You can't see whether the app has been launched in Jamf. So we can see that it's been deployed, and we can see that it's on the device, but we can't see that the app has been opened and in the Jamf console. In the Security Cloud, we can, but in the Jamf console, we just can't see that.
Okay, now this is
Yeah.
for the other guy. So I'm with UCSF, so I'm very interested in your use case with the Apple TVs and the iPads, and would like to engage with you a little bit more
Sure.
in the near future. Do you use any products that geofence the devices?
We do not. So we have rules in Jamf that restrict our iPads to our internal Wi-Fi network, so they don't work outside the hospital. And that's all we have used.
Okay.
There are some third-party tools that do that. Jamf doesn't have any visibility to the GPS location, unfortunately, but there are third-party companies that can do that. Anywhere from geofencing a whole system, or you can do real-time tracking if you really want to get crazy with it, or physical pucks that can sit near doors that can alert when a device is approaching it or leaving it. We have some third-party tools that do that too. Partners, which we can talk about. I won't give them a plug on this stage. And then there's something else.
While you're thinking, Tim, I can probably help with that one. So if we talk afterwards, we have some partners on our marketplace that we're already working with that do what you're asking for. So as Tim said.
Yeah.
Go ahead, Tim.
If you build an app, you can get access to the GPS location, and then you can track it yourself too. So like it is, fairly simple to insert some GPS aware, location aware ability into an app that could run. Has to be live. There's a lot of hassle to it. We'll talk later.
Lovely. Any other questions? I'm coming. I can run. It's on flat floor.
All right, someone up here has to ask the next question to make it run all the way over here.
Well, we do not have any Apple TV in our environment, and I'm trying to understand the use case scenario. Based on what I saw right now, is this something that we can be used for digital signage? And if yes, what type of content are you able to deploy? Was there some video, PowerPoint? What are the restrictions around it?
Yeah. No, go for it.
I was just going to say we've wanted to do some digital signage, haven't explored it much, and I was going to throw it to Tim to
sure.
talk about what you could do.
We see Apple TVs being used as digital signage, not just in hospital spaces, but in a lot of spaces. It's a pretty cheap box to toss behind a television and just be able to control from another location. The ones that we use internally at Jamf and all of the digital signage that we have up in our expo booth is all from a partner called Carousel. And I give them a pitch. They live right in Minneapolis with us, with Jamf. We've sort of grown up with Carousel, so I like them. There's also companies that can do really hospital-specific things, like being able to tie into EHR and EMRs and understand like what patient is in this room, or show awareness of whether or not, what level of PPE you need in order to be able to get into that room. There's lots of cool stuff. I see more follow-up question.
So just to make sure the integration wasn't from Jamf, the deployment wasn't from Jamf itself, it needs to be to a third party.
Yeah, Jamf can only deploy the stuff that runs on the screen and make sure that device is secure and up to date and all that jazz. We don't actually supply any video content in order to be displayed on the screen. Yep. Going up here.
Oh my goodness, running.
Thank you. I work in a K through 12 school, and as I understand your environment, you have one iPad and one Apple TV in every room, so 1-to-1. What I'm wondering is if we have teachers that may move around, is it possible to set up like a nurse that has an iPad assigned to them on a shift and they do rounds on multiple rooms? Is it possible to have a one-to-many configuration in Jamf where they could still do the same thing with the remote and the AirPlay to multiple Apple TVs from a single iPad?
Yeah, I've messed around a little bit with that. I have limited mess around with because I have limited numbers of Apple TVs. But you wouldn't want to use room as the differentiator or the thing that you would tie it together, but you could use floor. So that the iOS device could have a floor 1 or floor 2 or floor 3, and then all of the devices that you would have, all of the Apple TVs could also have floor 1, floor 2, floor 3, and then they would be able to go to all of the things that match that number. The trick is, and this is important more maybe in healthcare than it is in your world, you just, anytime you ask a human being to make a choice on a list, there's the opportunity to get that wrong. And when you are allowing them to share to a whole bunch of places, then there's more opportunity for error, and tying it one-to-one is just easier. In healthcare, we really cannot make the mistake of sharing this, a diagnosis to the wrong room. But it may not be as important in your space.
Okay, yeah, I agree and I understand. And I just wanted to share my experience recently. I had multicast issues with not only Apple TVs, but paging speakers. And so I completely feel your pain. And so I'm sure from a networking perspective, I assume you just put the iPads and the Apple TVs all on its own VLAN and just kind of let it be on its own and opened it up for multicasting and just let it run that way?
Yeah, so the TVs are wired, so they had to extend the VLAN that's onto the wireless controller for the iPads. And there's other issues and we think there's some issues on Apple's side as well, because the connection drops like every so often. Sometimes it's slow to connect. So the Bluetooth works all the time though.
Did your networking team really love being able to extend that VLAN into the?
They did, yeah. They said, we'll just do that overnight.
Cool.
Our security team loved it too.
Oh yeah, everybody wins.
Is there any other questions?
Love it.
No, we're
Did
good.
5 minutes early.
Look at us.
Yeah.
I usually run over, so they'll be proud of me this year.
Yeah.
Again, thank you ever so much for
Great.
joining. Enjoy the rest of your time here.
Thanks,
Have
everyone.
a good
Thank
day.
you.